Welcome to your open enrollment meeting. I work for a company called Blue Ocean Benefits and Consulting, and we are the consultant for your group to handle your employee benefits this year. I am going to go through your open enrollment packet and cover all the most commonly asked questions. I will also give you a number and some resources if you have personal questions that you want answered. And then you can speak with your team, your HR team, to make sure you have the right forms and turn the forms in. So without further ado, I will go through your benefits guide. You will have a copy of this as a PDF, and we will walk through the choices you have for this year. So both your medical and vision plan begin April 1st this year. The open enrollment period is today we're taping this on 3/17 through 3/22 for the 4/1 effective date. So you have over the weekend a little extra time to take a look at this information and go through it and see what you might want to choose. This benefits at a glance just tells you that you pay for your vision plan. It is voluntary, but the medical plan is paid for by a combination of your employer and you. We get a lot of questions about eligibility. Who's eligible? Are my stepkids eligible? Are my children eligible? Past 19, things like that. So this page just draws out the most common eligibility issues and the fact that your plan has a waiting period of 60 days for new employees if you're a new employee. Keep in mind this is open enrollment period, so this is when you can make changes to your plan if you're already an employee. You can add dependents, you can delete dependents. You can add, you can come on the plan if you're not on the plan. You can't do that the rest of the year unless you have what's called a qualifying event. A qualifying event would be if you're covered by your spouse and your spouse loses their coverage for some reason. Well, then you can come on this plan. So eligibility is sometimes, the situation that happens to you may not be covered on this page. So what you're going to want to do is talk to HR, and if it's very unusual, we'll be able to help on that too. But basically, these are the most common reasons that who's eligible, and then when you can make a change. So a marriage, a divorce, legal separation, obviously a newborn, things like that. Your program comes with preventive care at no cost. All the copays, coinsurance, and deductibles are waived when you use an in-network provider for routine well care. So that would be a checkup, an annual OBGYN exam, mammographies, even colonoscopies. One note of caution: if you're getting your first colonoscopy and you have no diagnosis, it's free or no cost. If you are diagnosed with something that requires you to get a colonoscopy, it may not be zero copay. It may be covered subject to your deductible and coinsurance. So for example, if you were to get a colonoscopy and you had a polyp of a certain size and your doctor said, well, normally we'd have you come back every 5 or 10 years, but we want you to come back in 3. That 3-year one will probably not be considered preventive because now there's a diagnosis. Also, routine visits, like if you're a diabetic and you routinely go every quarter, that's not a routine, because sometimes people use routine wellness. That's not routine wellness. That's a diagnosis of diabetes. So this is for your physicals, your kids' immunizations. Basically, if you're not sick or you don't have a diagnosis, then that visit where you're just checking on things is covered at no cost. Also, you're covered by Horizon, Blue Cross, and Blue Shield of New Jersey. Now, Blue Cross all across the country work together, and we're going to talk about that. But Horizon has a program called Horizon Be Fit. We have a flyer in the appendix that we will show you and you will receive a copy of that gives you more details on that. But basically, you can receive some rewards and discounts on that. So you have to follow the rules, of course, but that is in the flyer that I will show you in a bit. This is a kind of a page that a lot of times people just pass on through, but we think it's really important. Most people understand a deductible, what it is. The most important thing really on here is out-of-pocket maximum. If you follow the rules, there is an out-of-pocket maximum for your plan that the most you should pay. And it's just what it says. It's the most that should come out of your pocket. Now, when I said follow the rules, I just mean if you stay in network, if you get pre-approvals, it's not hard to follow the rules. If you go out of network, there is no coverage out of network on these plans. So obviously, you're going to owe that bill. It's not going to go towards your out-of-pocket maximum. I like to describe these plans, and keep this in mind as I go through the plans, but I like to describe these plans this way. That if you think of it from an insurance company's perspective, I always say they care about themselves. So think about it from their viewpoint. Your deductible is the first part of your coverage, and they are deducting that from what they cover. So that's what you're responsible for. So at the beginning, you're going to pay all of it. Now, there are some exceptions. You have copays that aren't subject to the deductible. Obviously, you have the well care that we just talked about. But there are things that are subject to deductible. If you're in your deductible phase, your insurance company covers it, but they're deducting that coverage, so you have to pay it. The next level is copays or coinsurance. So it might be 20%, it might be a copay per day, it might be, something of that nature. But in that case, you're co-insuring. Think of it that way. I'm co-insuring. They're paying some of it, I'm paying some of it. When you get to the end of that phase, you hit what's called the out-of-pocket maximum. And the out-of-pocket maximum is the limit to which you will pay, and then the carrier will pay the rest. So I like to say that first you pay all of it, then you pay some of it, and then at some point you pay none of it. So if there's $1 million claim and your out-of-pocket maximum of $7,500, you pay $7,500 and they pay $992,500. But you get there either through deductible or copays or coinsurance. So everything you spend goes towards those numbers. So keep in mind that the out-of-pocket maximum is really the number that you want to look at, especially when you're comparing the plans that you're offered. So we'll get right into the plan designs because there's a little subset network and things like that. So we have to so we want to spend a little time on that. So the 3 plans that you're going to be offered this year are include medical and prescription together. They always include that. Okay, they're offered, as I said, through Horizon Blue Cross Blue Shield of New Jersey. That's the Blue Cross affiliate for New Jersey, but it has a nationwide component. If you notice on all 3 of your plans here, it says with Blue Card. Blue Card is the national network, and how that works is when you're somewhere when you're in New Jersey, you're going to use Horizon's network. If you live out of state, or even if you're traveling out of state, then you will use the Blue Card network, and that Blue Card network is the local Blue Cross plan that you have there. The card is designed, and I'll show you that. The card is designed so that your local providers will know that. They will submit through their local plan, and it'll come to Horizon. So it's a really good plan because it gives you the entire country, every Blue Cross plan. I think there's 1 or 2 that don't participate, but almost every Blue Cross plan will be in network. So if you're in California Blue Cross or Blue Cross of Texas, and you want to see a doctor, if they're in that network, then they're in this network. So it's a very good plan in terms of nationwide coverage. Omnia is the type of plan. We have 2 Omnia plans, and then we have just a regular plan, and I'm going to describe those plans. Omnia is a type of plan that has a subset network, so it would only apply to people in New Jersey. Out of state is always tier 2. It's always covered. It's not going to apply. So if you're out of state, but you're picking plan 1 or 2, you're going to use that tier 2 column always. Okay, so Omnia is a way for people to go to a smaller network and get a lower cost, but it does not translate into the Blue Card environment that I just said. Also, we have 1 plan called an HSA. Now it says it's called Gold HSA. I would prefer it was called HSA compatible. An HSA is a health savings account, and you can think of an HSA as a medical IRA. The IRS says that if you have a plan that is qualified, in this case, the HSA compatible plan, you can put money away tax-free, and then you can spend it tax-free as well, or you can keep it in there. It's not a use or lose like an FSA, like many of you are familiar with. It is money that you put into a health savings account. It's a special bank account, qualified bank account, and it comes off your taxable income, and it can be used for medical expenses. It's a really cool thing. I have one myself. We offer this to our employees. I have one myself, and I've had it probably for 15 years. So what we're going to do this year is, if you are interested in opening an HSA account, we're going to have you call our office, Blue Ocean, and talk to us about that, rather than get into all the details here. You can pick the gold HSA plan and not open an HSA. So just to go through this, so HDHP is what the IRS calls it. HDHP means you're eligible to open and contribute to an HSA account, okay? Don't just open a regular bank account and do it. You have to open a special one, talk to us. We'll give you some banks that you could use, and we'll give you some ideas. But it's really neat because you take a high deductible, you put the money away tax-free. If you ever need it, you can spend it. If you don't, you keep it, it rolls over forever. And then at some point when you hit age 65, you can take it out. Also, you can take it out for any reason, for any medical reason, anytime. But you can also then take it out and just pay. You can pay taxes on it. There is a penalty if you take it out earlier, so it is a little complicated, but it's not that complicated. It's easy to understand. So if you want information on this, I will give you the number to call about that. And if you're even a little interested, call us and let us kind of go through it with you and explain it to you, because it really is a neat item. However, an HSA always has a higher deductible, and everything except the well care I mentioned earlier is subject to deductible. So you may not want that. You may want the silver plan. You may want the EPO silver plan because it's a more first dollar coverage. The Advantage EPO silver plan. So there's the silver blue card plan. There's the gold HSA plan. And then the Advantage EPO silver plan does have in-network only, but it doesn't have the 2 tiers. It's just 1 tier. So if you're out of state, you might like that plan better. It just depends on how you feel and the contributions that you're paying. As I said earlier, the Omnia network, the 2-tiered Omnia network, how it really works is, if you go in network, you may pay less. You still have that maximum out of pocket, and that's tier 1 and tier 2 combined. So if you go in network, in tier 1, I should say, it's both in network. If you go tier 1, you may have a lower out of pocket, okay? You may not. But on tier 2, you're never going to pay more than tier 2, and I'll go through that on the next, in a page or two. Network. So this is always an issue for folks, especially when we have people across the country. So put this in here. This link does take you to the Horizon website, but I have it pulled up here, so I'm going to just slide it over. There we go. Sorry about that. So the Horizon, the website for your plan is horizonblue.com. If you just go to click Find a Doctor, you can call up the network. So it comes up like this. Once you're a member, you can sign in and it'll know what your network is, but you can also just continue as a guest, of course, right now. If you're already a member, you can go in on your portal with Horizon and go there. So in New Jersey, you can use this area. You say, what kind am I looking for? You click medical, you can find a doctor. If you're going out of network, you click down here at the search nationally. And that's going to take you to the Blue Card network, the nationwide plan that all 3 of your plans have. So now, again, if you're looking in New Jersey, use that network because that's the network. But if you want to search outside of New Jersey, you click on search nationally and you choose a location or plan. So let's just enter a zip code. We'll enter a Florida one. It's Fort Myers. And we'll say, yes, this is correct. Now, this is what I was talking about earlier about your card. You're going to have what's called a 3-letter prefix. You're going to type that in here because it tells them what kind of plan you have. You also then have in your ID number, HZN, that stands for Horizon. This card allows providers for the claim to be sent properly through, in this case, Florida Blue Cross to New Jersey Blue Cross. This suitcase down on the bottom, all of your cards will have a suitcase and they will have the letters PPO in it. Now that's a little confusing because you really have an EPO, not a PPO, but that is assign to the local doctor in your area that, hey, this is a blue card plan. I can submit my claims locally. They know what that means. So this suitcase, this one shows nothing in the suitcase, and that means this plan doesn't have blue card, but all of your plans have that, and they would have a little suitcase in it. So you would just enter your prefix. It may not be XYZ. I'm just using that. And so we'll just pick, a blue card PPO, it's EPO. So, and then it'll say doctors by name. Now it's taking you to Fort Myers, in this case, and it's fine that. So doctors by name, you click on doctors by name and you type in a name and you can call up, all the doctors. Okay. Now you can obviously talk to your doctor and you can say, look, I have this plan. It's a blue card plan. You participate in the blue card. They usually know. They certainly know if they participate in the local Blue Cross plan. So you can, talk to them and ask them. But this is an accurate search engine. The only thing I would say that does happen is if someone has left the network, the search engine may not quite be updated, or if they've just recently joined the network. Also, if you don't find them, you should call them, because sometimes they'll say, well, I'm on the waiting list. They're working on my paperwork, but my partner's in, and you can just go to one of my other partners. You can go to me, but we can bill it through them for the time being. Not supposed to do that, but they do it all the time, and Blue Cross knows they do. So they're not really supposed to do that, but sometimes they have legal workarounds to get you in there, even though they might not be in the plan, but one of their partners is. So that's just a quick how to find doctors. I know that's an important item for all of us. So that will get you. That gets you, sort of there. If you have any trouble with this, again, I'm going to give you a resource to call us directly. One of the things that Blue Ocean offers is we let you call us. We prefer that you call us directly. Okay, you don't have to talk to HR. Certainly, you might have to in a certain circumstance to get on the plan, to get off the plan. You might have to talk to them about that kind of stuff. But if you have a question about your benefits, or you have a surgery planned and you want to run it by us, you're welcome to call. I will give you a real life example. I talked to an owner of a business a few months ago, and he was about to get a surgery. And he said, the doctor's in network, but the surgery center is not. And the doctor told me, don't worry about it. We'll take care of you. And I said to him, you can't rely on that. Here's what you have to do. You have to ask them this and this and this. You have to get it in writing. And if they won't do it, you have to do it at the hospital, which was across the street. He said to me, well, I've known this doctor longer than I've known you. I'm not comfortable doing that. I said, okay, so when you get a $5,000 bill for that and it's not covered, you're not going to call me, right? And he laughed. I talked to him about 6 weeks later. I said, what happened with that? Did they put it in writing? Because I wasn't still sure if he was going to ask them. He said, no, they wouldn't put it in writing. So I went across the street and did it at the hospital. So he used the same doctor, but he went to an in-network facility and saved a lot of money and a lot of headache. If I hadn't talked to him, he probably would have done it. Then he would have wanted me to try to fix that claim, which I probably couldn't have done. So feel free to call us anytime. You can call us about this stuff. You can call us about doctors, anything you want. It's ounce of prevention is a pound of cure, as we all know. All right, so here are the 3 plans in more detail. As I said, all 3 of them have blue card. The Omnia plans have a tier 1 and tier 2. The Silver Advantage plans do not. The EPO Silver does not. All the plans are in-network only. None of the plans require referrals. I know the Omnia plans say tier 1, tier 2, but there is no out-of-network on these plans except for prescriptions. They cover them, but I'll get to that in a minute. So the tier 1 deductible on the Silver plan is a little lower. The co-insurance is a little lower. The maximum out of pocket's the same. So if you were to meet the 9,100 in tier 1, then decided to go to a tier 2 hospital, you wouldn't have to restart. It would be already met. If you met the deductible of $2,250 but not the max, you would have to hit that additional $250 in the deductible to get back into the co-insurance, but doesn't usually happen. So there's just a little advantage to going into tier 1 physicians. Now, as I said, all doctors outside of New Jersey are tier 2. So if you're a tier 2, if you're an employee that is not based in New Jersey, you're going to be looking at tier 2 exclusively. So you can see they're pretty much the same, a little higher coinsurance. Preventive is 0. The office visits are a little higher on the tier 2, and I'll tell you why tier 2 is higher, because of those out of area doctors. There's a fee involved with the local Blue Cross, so it's just a little bit more expensive. But the copays are 40 and 60 for tier 2. They're 30 and 50 for tier 1. 0 for diagnostic, office independent lab work like LabCorp. It's pretty much LabCorp. Go to LabCorp, it's going to be a 0 copay. You go somewhere else, it might be 50%. So definitely ask for LabCorp. Imaging, a little more expensive imaging is subject to the deductible. Okay. So you're going to meet the deductible first. So if it's a $800 MRI and it's knocked down to $400, you will be responsible for that. Hospital confinement, same thing. It's after the deductible. Now the deductible is annual, right? So if you met the deductible in January, then all these things are coinsurance, and they're not. You're not going to meet a deductible every time you go, unlike your car insurance. ER, they definitely don't want you to do that. So that's $100 copay and deductible and coinsurance. They definitely want you to go to urgent care. But it is the same tier 1 and tier 2. Emergencies, there's no really such thing as a network, okay? So don't stop and look for the network if it's an emergency. Go to the nearest emergency room, take care of things. If you have any problems with claims, with that, we'll help you. Sometimes you get those claims bounced back as out of network or because they're not coded right. And so rather than pay them, you let us know. We'll help you get in touch with the doctor, recode it so that it's coded as an emergency, and then it gets paid, okay? Emergencies are paid. Also, out of country emergencies are paid. They're a little trickier. Sometimes you have to pay them. We sometimes have to get things interpreted, but we've had Horizon pay claims in France, Costa Rica. I had Aetna pay one in Aruba. We've had over the years many claims paid that were out of the country claims. The one in Costa Rica Horizon paid was a heart attack, and they had to transport the guy 4 hours over the mountains, and he lived. So you do have emergency coverage anywhere in the country, and for that matter, anywhere in the world. Prescription is tiered depending on the plan. I'm going through the silver blue card plan. I'm going to swing back to the other two. It's a $25 copay for generic at the retail. Mail order is $50, and that's a 3-time supply. But if it's a $4 drug, you're going to pay $4. You don't always pay $25. If it's amoxicillin and it's $3.68, you're going to pay that. A lot of drugs are generic, and I have a generic drug. I think I pay $3 every time I fill it. So you don't have to pay the $25 unless it's more than that. The preferred drugs on the silver plan are 50% after that. Now, the average retail drug is probably about $140. So actuarially, 50% of that is $70. And that, works out to what's similar to copay. But if you're on a very expensive drug, you may have to put out some money up front. So that may be a time when you're going to look at maybe the other two plans, because they have a different copay structure. I did fail to mention that RX has a $250 deductible separate from the medical deductible. Everything here still goes to that out-of-pocket maximum. So theoretically, you could meet your out-of-pocket maximum using just drugs and office visits. It's all one big bucket, but so that's a protection number. But you have a $250 deductible, then these copays kick in. And specialty drugs are 50%. They're not covered out of network. Now, when it says out of network, I would not use an out of network pharmacy almost ever. First of all, there aren't very many. Most of them are in network. It's a huge network nationwide. But an out of network might be a compounding pharmacy or something. They can charge you more than the copay. They can say, well, this is what they allow to pay the copay, but I want the extra $50 or $100 that they're not paying me. So try not to go to an out-of-network provider. Almost all pharmacies, and certainly all the major ones, are in network. Okay. So that plan, $25 generic, but 50% for preferred drugs, name brand, for all name brand drugs. A preferred drug is usually one that's not that expensive and not available as a generic. If something's available as a generic or new or really expensive or experimental, you're going to find it in that non-preferred category. And So if you end up with a drug that's non-preferred, in this plan, it doesn't matter, they're all 50%. You might say, well, is there a generic equivalent, that kind of thing. And pharmacies are pretty good about doing that these days. So that's the silver blue card plan. It's a pretty straight up plan. It's a $2,500 deductible for tier 2, 50%. Most you can spend is $9,100. That family maximum is all of you. So if you have one person at $9,100 and one person at $4,000 and then one person at $5,100, you're done. I know it's a big number. It is what the Affordable Care Act calls for. It's hardly an affordable number, but it is a protection number. So if you have a $100,000 claim, you're going to pay no more than $9,000. And if you have multiple claims that year in your family, altogether, you can pay no more than $18,200. These days, a hip surgery might even be like $50,000. So you're talking about huge numbers. So relative to what we see spent, this is a small number. I just did a chemo fusion. It wasn't even chemo. It was something else. It was $70,000 the hospital charged for an outpatient. I think it was knocked down to 30. The carrier paid 30. So, that puts these numbers in perspective. I know they're big numbers, but that's how that works. Now, the gold plan, two things different about that. One, it's got lower out-of-pocket maximums, and also it's that HSA compatible plan I mentioned. So in this case, everything's subject to the deductible. So if you look at the office visit, it says no charge after deductible in tier 1. You'll pay that whole $2,250 deductible for everything except well visits, and then an office visit is free. That's in tier 1. In tier 2, it's a $2,350 deductible, and then things are 20%. So an office visit, $80 office visit would be $16 after the deductible. But you are going to have to pay the entire office visit until you meet the deductible because it's an HSA. If you were to put away $2,300 a year, you'd basically cover your deductible. If you don't spend it, you keep it. If you do, there you have it for that. So that's something that a lot of people are choosing. This is actually the plan I have. That one right there. So after the deductible is 20%, the maximum out of pocket, even on tier 2, is only $7,050. The maximum out of pocket in the tier 1 is $6,000. So it's a little bit different. But again, most important thing about this plan is that everything's subject to the deductible, and it allows you to open and fund that HSA account where you can put tax-free dollars into your own account that is yours. That account, by the way, is not, your employer is not going to have any access to that account or see it in any way. It's your own account. If you misuse it by buying a TV, it's between you and the IRS. Your employer is not really involved in that. So, but they're really neat, and I have one. So again, if you're interested in that, you're going to call our office. The third plan, I did want to point out on that plan, the drug card after deductible is a copay. So if you're on an expensive specialty drug or expensive preferred drug, you might take the deductible, pay it, then everything will be copays after that, and that might make sense for you. So if you met your deductible of $2,350, then all your doctor visits would be 20%, and your drugs would be a copay. So it's a good plan. It just has the deductible because that's what is required for the HSA. But you can see this, in this case, the drugs are 10 for generic, 40 for preferred, 75, but it's after deductible. Finally, the Advantage EPO Silver Blue Card, a little simpler for those of you out of state especially. $2,450 deductible, 40%, $8,900 MOOP, $45 copay, $70 for specialist, no deductible, only one network, and that is everybody, the Blue Card network and the Jersey network. It's the tier 2 of the other two, so it's the bigger network. Just one network, everything is copays and all that. Again, diagnostic $0 if you go to LabCorp, $100 if you do it in the hospital, don't do that. And also the MRIs are, instead of being a percentage, they're $100 after deductible. So maybe you call this a little bit better of a plan than the other two, but then the premium's lower. Also, this one has the 10, 40, 75 drug card, and there's no deductible, okay? It says after deductible, but then above it says not applicable. So this card, it doesn't say that, I'm sorry. It says deductible does not apply. 25, 50, 75, sorry. 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, 75, 25, 50, So no deductible for doctor visits, no deductible for prescriptions. The deductible only applies to major services and hospital. Okay, we'll talk about cost in a minute on those plans. There's also a vision plan. Actually, I'm going to just go back. So the three plans, how are you going to make this decision? Well, you're certainly going to look at network. You're going to look at the out-of-pocket versus the cost and say, do I need this plan? If you never go to the doctor, if you never have anything happening, you're probably best off with the lowest cost plan. If you know you're going to have surgery, you might be better off with that blue card plan because you pay the deductible and then it's got a lower out-of-pocket after that. So it really depends on what you think might happen. If you tell me what's going to happen, I'll tell you which plan to buy. But by and large, the more you pay, the more you get back. But you don't, especially medical insurance, you're not necessarily going to use it. If you're not going to use it, then you should pay as little as possible. That's where the HSA comes in. You can pay a reasonable amount for that coverage, save the deductible, and then if you don't use it, you keep it all. That's how I would look at how you choose. I would look at the out-of-pocket maximums. I would look at the out-of-pocket out of your paycheck. I would multiply that to an annual number, and I would just look and say, are these worth it? Is it worth it for me to get this better plan for X amount more? Vision plan is also offered by Horizon, but it uses a network called the Davis Vision Network. You can see that right there. That's a national network. That's the network your vision provider is going to look at. Now, this is routine vision. If you get poked in the eye, it's covered under your medical plan, okay? It's not all eye care. It's routine vision care. So glasses, checkups, things like that. If you go in network, you get a $10 copay for an exam, $20 for materials. What you're going to do is call the eye doctor and say, do you take Davis? That's all you're going to do. Don't mention Horizon. It's okay to, but they may not know Horizon, but they'll certainly know Davis. Okay. If you end up getting glasses or contacts, it's $25 copay. And then what you get is sort of an allowance. So you get certain level of frames. If you want more, you have to pay more. So for example, they cover up to from their collection, they cover up to $160 retail. And then you'll pay $20. You'll pay after that. You have to pay. Okay, so I got glasses. The plan very similar to this. They were like $800 all in with the progressive lenses, and I paid about $400. So you're definitely going to get a big discount if you just take from their allowance. You really could get out of there for $35, but most people buy up a little bit. If you go out of network, you're just going to get reimbursed. So you're going to get $40 back for an eye exam that might be $200. So you're still going to get your premium back, but you're going to have to submit a claim. You're going to have to get money back, and it's not going to cover near as much as if you go in network. Okay. Contacts are covered as well, as you can see, and I'm going to show you in an appendix a much more detailed benefit summary for this. So you have the medical plan. You pick one of three. You have this vision plan. It's either yes or no. And this is what I talked about earlier. So this is our number here. So we have both the 800 number and our local number at the bottom, 732-759-2836, or you can dial the 800 number. In either case, you press 1. What that does is ring every single phone in the building that is service people. They know then it's an employee with a question as opposed to your employer calling us directly. And then if everyone's on the phone, it happens once in a while, it'll go to a voicemail that they all get, and then someone will call you back. So it's not an 800 number in the sense that we have a queue and all that. If you want to call Blue Cross directly, you can do that as well. But this is for really escalated issues, for us helping you with something. You get a claim not paid and you think it should have been. You have any question, like I said before, my example of something early coming on. That's something you definitely want to call us. And you can just call us or run a scenario by us. Hey, I'm thinking about doing this. How's that going to impact me? What should I do? Am I thinking through this right? Benefit summary, duplicate ID card. Now, I will tell you, Verizon's got a great website and an app. I have the app on my phone, so you can actually put in, you can open your phone and your ID card's on the app, and you can forward that to yourself in an email, print it. So I don't really need a traditional ID card, but we'll get you one if you need it. You can always print it on your phone, and you can use Horizon's system to pull down explanation of benefits and things like that, and we would help you with that. But if you have questions about your plan, feel free to call us. And we're not going to tell your employer about the call because they don't want to know. And you don't want them to know, they don't want you to know. So you can really call us with just about any question. We're not going to reveal what we talked about. It's just employers don't want to know these things. So this is a really nice feature service. Here are the contact information for your group. So you want to call Blue Cross directly, you can. And by the way, Blue Ocean, we're not affiliated with Blue Cross, just happen to have a similar name. HorizonBlue.com or the 800 number, there's your group number, and then of course your ID number will be on your card. For Vision, there's your group number, same, your ID number also. You can call a different number. That general benefits question claim assistance is the number I just showed you. That is the blue line. Okay, so that's our office, and we can coordinate everything for you. Now, this document has an appendix, and so it's a 14-page kind of high-level document that you will have a copy of when you watch this already, because I know Leslie will get that to you this year. But we also have an appendix that has all the details of what you might want. So this is called an SBC, this page here, and this is a sort of a federal document, so it has a certain format to it, and every plan has them. So you can actually use this document to compare it to your spouse's plan and look at them. I do want to point out that at the top it says all co-payments and co-insurance shown, costs shown in this chart are after your deductible. So unless it says no deductible, assume the deductible applies, okay? But there's detail. It's all what we just showed you, but there's more detail in here. So for example, shows you how an outpatient surgery works, emergency room, urgent care is also, also covered in here. Where's the urgent care for regular? Yeah, so urgent care is here, home health care, that kind of stuff. Children have some additional coverages, but not adults for dental. That's ACA. So each plan, we have three summaries in this appendix. Okay, so they're all very detailed. They have the exclusions like bariatric surgery, I think is an exclusion. Yeah, things like that. And this document, like I said, is a standard document, so you can kind of compare it to other plans, and you can compare it to each other. So the first one in here is the is it a little cut off? Is it a little cut off? I think it's the gold plan. The second one is, as you see here, the silver plan. And the third plan is also in here, the EPO silver blue card plan. Okay, so each plan is laid out in this format with a lot of detail if you want to see it. After that, in this appendix is the prescription plan, or the vision plan, and that's laid out a little bit more detail than what we just talked about. Some frequently asked questions, that member service number, you need a claim form, things like that, and of course you can call our office. The pricing for each plan is listed here. This is what you would pay. Now it's the age of when you join the plan. So if your birthday is in August and you join the plan in July, you're going to get the rate that the age you were July 1st the whole year. It doesn't change when your birthday hits, okay? Just so you know. And that goes for your dependents too. So this is the document that you can figure out how much will come out of your paycheck. And this is unique to you. This is not the actual cost of the plan. This is after your employer's contribution. The vision premiums are straight up per pay period, 26 pay. That's what they are if you want that. And that is a voluntary plan. And your enrollment can be different. Your enrollment can be family on the medical, single on the vision, or vice versa. They're not connected in terms of who has to enroll. So if you want to go single on the medical and the rest of your family is on your spouse's plan, but you all want vision, that's fine. You can put your spouse on, no problem. The blue line flyer again in the appendix. The wellness, the Horizon Be Fit plan I mentioned, that there was a document in here that's a little more detail, and you can go to that website and find out more. That's just the second page of it. So this is a little extra document. As far as signing up, you're going to get a, from Leslie, you're going to get a sign now form, I believe. So she's going to give you the documents that you need to either sign. You either need to sign up or you need to waive. If you're already on the plan, you can change between plans. If you're just joining now, you can get on whichever plan you want. That election is 1 year. You cannot change plans next month. So once you pick the silver blue card plan advantage, you cannot change your mind and switch to the gold plan on January 1st. This is a 1-year election. Okay, so I've covered HSA. If you have any interest in that, you're going to contact us. You're going to make your own contributions to that. And we can walk you through all the details of that. Like I said, we offer it. I've had it for 15 years. I always cover myself that way. We talked about the demo for the doctors. We talked about how to compare these plans, out of pocket versus your cost, what's worth it to me, and do I have stuff happening? Do I have things coming up? So other questions you might have. You might say, well, I do have this. I have this issue. I have diabetes. How will that be impacted on each plan? Call us, call the blue line, and you'll talk to, in this case, you'd probably talk to Dawn or Jennifer or Nick this year. But that is something we can just sort of walk you through. If you think that your decision is based on something that is unique to you, call us and we'll help you. If you have any questions, call that number. And we will talk to you directly. And that concludes this meeting. Normally I would open it up for questions, but this is a tape meeting. So any questions, direct them right to the blue line or via that email, I believe was in the, not in the appendix, but in the, this email here, service@blueoceanbenefits.com. You can also send us an email. Okay. All right. My name is Matt Roy. And I appreciate your time with Blue Ocean Benefits. If you have any questions, give us a call.